Hello everyone, welcome to our channel Clinical Knowledge and Medicine. Let's learn about hydrocephalus. Just look on the picture, it shows that head becomes enlarged. So hydrocephalus is a condition which results from imbalance between production and absorption of CSF, cerebrospinal fluid. हाइड्रोसेफेलस एक ऐसी कंडीशन है जो CSF है वो प्रॉपरली एब्जॉर्ब नहीं हो पाता, प्रोडक्शन के बाद उसकी एब्जॉर्प्शन नहीं हो पाती, जिस वजह से वो एक्यूमुलेट होना स्टार्ट हो जाता है और इस वजह से हेड का साइज एनलार्ज हो जाता है. इट इज़ अ कंडीशन इन विच पोर्शन ऑफ द एंटायर वेंट्रिकुलर सिस्टम इज abnormally dilated and CSF is under pressure. Classification and etiology depending upon the site of block. Non-communicating and communicating. Non-communicating में maldevelopment of aqueduct, obstruction due to mass lesion, obstruction secondary to exudates, obstruction of fourth ventricular outlet formula. Communicating post-infectious, post-hemorrhagic, after neonatal meningitis, arachnoid villi obstruction, skeletal defects. Depending on the time of presentation, congenital hydrocephalus, intrauterine infections, congenital malformations, congenital midline tumors of CNS. Acquired hydrocephalus, TB, meningitis, post-fossa tumors, AVM, atriovenous malformations. Clinical features: head enlargement, face remains small, sun-setting eye sign, separation of sutures, scalp vein prominent, wasting, crack port resonance on skull percussion, McMahon's sign, lack of physical and mental development. Diagnosis: head circumference, widening of squamoparietal sutures, radiograph of skull, CT, ultrasound, MRI. Treatment: stationary or arrest type, progressive type, localized site of block, acetazolamide, isosorbide. For expanding lesion, surgical treatment, ventriculolateral and ventriculoperitoneal shunt. It's all about hydrocephalus. Thank you.